we are going to learn all these kind of things, okay? Not only the drawing or outline form, but also the guide on how to, ideally prep these beautiful class 2s, okay? So the reason why the school teaches a class 2 is not because, we use it daily in our clinic, but it is the best tool to evaluate your hand skill, okay? So following the exact guide is very important, not for your patient, but for your clinical skill. So here are also some drawings, but we are also going to tackle the actual guide for you to be guided and prepped nicely so that you will get a good score. So, first of all, always center the groove when you prep or draw, okay? If you draw nicely, I guarantee you that you will prep nicely because what you have in your mind will be printed upon or transferred upon the prep, If you don't know how to draw well, which means that your prep gonna be what you have in your mind. Alright, so first you need to identify the grooves, right? It is easy, the deepest area, and these are the grooves. Okay, you need to first know how to identify the grooves and draw the grooves, right? Alright, so even though it feels like too elementary, but you need to do it. Alright, so we have identified the grooves, and now we are gonna prep the tooth with the drawing, okay? So first we need to find a contact area, okay? So for the molar, the posterior wiggle, it has a broader contact area like this. Of course there is a contact point here, but I am telling you, the reason why I'm telling you contact area is that the S curve will not be just from the contact point, but contact area. So the molar, this one has a broader. Identify it, okay? I'm gonna draw first DO on first molar mandible, okay? So I have identified contact area, and I assume that this much should be 0.5 millimeter, okay? And we have to achieve a 0.5 millimeter clearance. As you can see here, it should have a clearance of buccal, lingual, and gingival 0.5 millimeter, right? So the reason why we are achieving 0.5 millimeter clearance is for the cleanliness. We want to brush or floss the area where amalgam and the tooth structure meet. Okay, if it is in the contact area, the amalgam and the tooth, the junction is in the contact area, we cannot clean the area, right? And if you get to make it too wide, okay, then we are undermining the cusp area. That's why we just want to keep as conservative as possible, yet it is cleansable. All right, so I'm gonna change my color to purple. It's gonna be purple prep. So my S curve would be here, and the tricky thing on the first molar mandible is that it has a small distal cusp, right? So in this case, we don't want it to really dig into the make a big S curve that will compromise with the distal cusp. So go a little bit like this, and it's gonna be kind of abrupt S curve like that. One more. Okay, and I'm gonna, this angle is too sharp, so slightly round, and then here we don't want it to be like that, then we are undermining the if we prep like this, we are undermining this side of enamel. We don't want to leave any unsupported enamel. Okay, so we always want to keep it 90°. And here dovetail. Okay. Alright, so this one, abiding into the principle. Here we have kept it 90° to the outer surface. Okay, and I'm gonna draw here the actual pulpal line angle following the outer surface. Okay, it should follow the contour, and then actual pulpal line angle bevel. Let me draw it. Okay. And this area needs to be beveled with which tool? Gingival margin trimmer. Okay, so here I'm going to show you. Okay, so this area, this actual pulpal line angle needs to follow the outer surface. Like this is the outer surface. It should not be like that, right? So, and also the actual pulpal line angle needs to be beveled. So if you look here, it is not beveled. Then when you do the restoration with amalgam will crack at this point, because the sharp corner can cause a fracture of the amalgam. So if it is beveled like that, then amalgam will not fracture. Okay, so keeping that in your mind, I will prep it in this way, but there are some variation. I'm going to also show you the variation. So the variation here is that because of this groove, you know, some people would include it in the prep, you know, like this, and also make it straighter. Make it straighter because, you know, this is a kind of reverse S curve. So some people would make it straighter. Okay, that would not be a big deal. And even though it has a grooves all the way, doesn't mean that you need to include everything. Okay, just this much should be beautiful. Okay, so this was the DO on class 2 lower mandibular tooth, and now I'm going to show you MO. Okay, so MO from the contact area, leaving some 0.5 millimeter clearance. Let me mark with blue. 0.5, 0.5, and